Thank you.
Thank you, Cancora. Taoiseach, the shambles that is the health service has been repeatedly raised in this House over the years, only to be treated with contempt by your government, with excuse after excuse as to why nothing seems to change. But the situation in relation to mental health services goes largely unmentioned, but particularly so when it comes to older people. Last Friday, the people of Donegal learned that mental health services for older people in the county has been closed. But not only has the service been shut down, it has been closed since September 7th this year. For 3 months we heard nothing about this from the HSE, or from your government for that matter. It was only when concerned family members who were having difficulty accessing services and clinics came to me that we discovered this situation. It turns out that a letter was sent to all GPs and senior HSE staff in the county by the clinical director of the service. In it he stated, all referrals received by the mental health service for older people will be returned to sender. Returned to sender, Taoiseach. He went on to say that a liaison service to Letterkenny General Hospital can no longer be provided, and that care of the elderly services in Donegal are now the sole providers for all needs of the elderly population in the county. This letter was sent because, in his words, without urgent contingency planning, the Donegal Mental Health Service can no longer provide a consultant-led, safe service for the elderly population of Donegal. Taoiseach, 78% of over 50s with depression are undiagnosed in this country. A further 85% of people over 50 suffering from anxiety are also undiagnosed. Signs of depression in elderly people could also be symptoms of the early onset of dementia, and without a service for older people, many people could go undiagnosed, leading to extra costs on the health services. Taoiseach, being from rural Ireland, you should know that many of our elderly population suffer isolation and loneliness, and this can lead to increased anxiety and depression.
Thank you.
Taoiseach, how can they get help when services have been shut down? Mental health services have lost over 1,000 staff since 2008. Taoiseach, and in January this year, staffing levels were only 77% of that recommended by Vision for Change. So, Taoiseach, what are you going to do to restore the mental health services for older people in Donegal? When can we expect to see a consultant-led service in the mental health services that your government has said is a priority? And do you think it is acceptable that GPs should be left to deal on their own with patients who present with mental health problems?
Thank you. Taoiseach.
The first thing I would say to Deputy Pringle is this, and thanking you for your question. In order to be able to provide proper services for people right across the board, you need an engine in the economy to drive that. And that's why the government have been deliberately focused on sorting out our public finances.
Stay quiet, will you?
On creating jobs that pay well, and the more you have working, the less tax people have to pay, and the greater the opportunity to invest in services like what you mentioned. Now, the vote for the health department for 2016 is €13.175 billion, 13,000 million euro. That's the equivalent to an increase of €880 million over the 2015 allocation. You're aware, Deputy Pringle, that the Health Service Executive are required to prepare a service plan as to how they expect to provide services for people in the health area, and send that to the Minister for Health, who has 21 days to respond to their proposals. The situation is obviously, has always been, that there are challenges in the health system. Now, the service plan was submitted to the Minister for Health on the 4th of December. The Minister and the Department will assess that plan now from the Health Service Executive. He has 21 days to return that with his recommendations as to what will happen. Obviously, the total level of funding, therefore, available to the HSE for 2016 is just over €13 billion. So the priorities will be identified within that, both by the HSE, confirmed by the Minister, be sent back to the HSE for implementation. So what I can say to you is that the scope for vast improvements in 2016 is not there, but there is scope for modest improvement, and a number of service improvements are planned, including the implementation of the National Maternity Service, additional funding for mental health, which is being handled by Minister of State Lynch, who has done a wonderful job there, further developments in primary care, and enhanced therapeutic services for young people. I take your point about older people with dementia problems in Donegal. It's the same thing all over the country. They all deserve a better service, and the best service we can give them. And in order to provide that better service, Deputy Pringle, you need an economic engine that will create that investment. And that's why government will continue to focus on jobs that are well paid, so that the more you have working, the less tax they'll pay and the better these services can be. So the Minister will return the programme with his proposals to the HSE to implement it. And one of those priorities is for an enhancement of services in the mental health service area.
Deputy Pringle, thank you.
Taoiseach, we've been hearing about this so-called engine in the economy for the last couple of years now, and you're talking about so-called recovery. Well, that engine hasn't spluttered into life for anybody outside of the Pale in this country. And for you, Taoiseach,
thanks very
to
much. He's
say
quite
that
capable of handling himself.
you're providing extra funding for the health services. The budget for the health services is still €1.5 billion less than it was before the economic crash. So you're not providing the services. And your government has been focused on giving tax breaks to the wealthy and improving the lot of the wealthy in this country without looking after the citizens that are crying out and in need of services. And your answer, Taoiseach, isn't good enough for the people of Donegal and the elderly population of Donegal who don't have a service to go to. And the GPs that they attend to looking for help and crying out for help, their letters and referrals are being returned to sender by the words of the mental health services itself in the county. Taoiseach, this matter needs to be addressed as a matter of urgency. The staffing needs to be provided to allow the service to be restored and be put back up and running. And it's not enough to say that the service plans have to be reviewed and the word has to be sent back again by the Minister for Health.
Thank you.
You have to act to make sure that the services are there for the people that need them.